Hi everyone, this is Ryan Hoyme, aka Massage Nerd, and right now I have Doug Nelson. Welcome, Doug.
Thanks, Ryan.
Yep.
Great
so,
to be here.
what do you think about the Congress so far?
Yeah, I think it's such an important gathering of massage educators, both from the people who are dealing with entry-level education, but also the continuing education providers, and bringing them together and talking about the issues that I think affect all of us. And I think having that conversation is so important, and having everybody who has a seat at the table at that conversation.
Yep.
It's huge.
Yeah, and so even like the panels and stuff like that.
Yeah,
and,
you know
yep.
what's interesting, it's oftentimes how we respond to things are answers, but really what's the question, you know?
Yep.
And I think this time, I think it's really good to savor what those questions are and get real clarity about how is it that we can move the profession forward, and what are our goals, and what are the steps that it would take to do that. But before you can have steps, you need to know, where do we want to drive the bus, where are the needs, and how might we best respond to that.
Yeah.
For me, as a continuing education provider, you know, it's those same issues, but there's never really been a forum other than talking to other providers who are also doing the same. This is a way to bring all of us who are doing that together to explore some of those issues.
Yes. And what I've noticed is a lot of massage therapists are so isolated too and stuff. So this kind of brings them together, and so they don't.
You know, when you are struggling with an issue, and you're isolated, you can't help but feel, is it just me, right?
Yeah.
Am I the only person who sees this, or maybe I'm doing something? You know, you can't help but take that perspective. When you talk to other people, and you just, maybe more so than talking to other people, but listening to other people, and you hear the same sorts of concerns, it's very confirming. And I think once you get that sort of enough people hearing that, then as a group we can respond, and there's power in numbers.
Yep, and I'd love to learn about your modality and stuff that you teach and stuff like that. So could you explain a little bit about that?
What I teach is something called precision neuromuscular therapy. And you know, I often joke, Ryan, that if you look what I taught 15 years ago, you could probably rename it, I have a fabulous answer, and I hope you find a question that goes with it someday, right?
Yep.
Right? You know, here's what you do. And then, you know, over the years, it's kind of the same issue, which is, what's the question? When someone presents with some sort of problem, you know, how do you know, to the best of, your abilities, that this is the issue, and what things did you not consider along that way? And maybe more importantly, what do you do when your go-to strategy doesn't work? Mm-hmm. Because guess what? As somebody who's in the clinic a lot, it's not. There are many times when it's not going to work, right? What do you do then? And I think it's all about the choices you make and why you make them, and you're going to make choices that are incorrect, but kind of. But how do you know they're wrong, and how quickly do you know that? And I think it's a lot like, Ryan, having a GPS system. You uplink, but you don't uplink every hour. When you're driving, that may not go well. You need some sort of feedback mechanism to say, am I on the right path? And most importantly, how will I know when I'm on the wrong path?
Recalculating, yep.
Yeah, exactly. You recalculate. And then, what is it about U-turn that you are not getting? Right? Yeah. So I think as a therapist, it's so important. And I think what guides me is being in the clinic every day, and really having people say, that really cool stuff you did last time, actually that didn't help. It's like, okay, great. How do we recalibrate this? And I think that's important. I think it's important for students to know, because I am in the clinic. And guess what? If you have that idea that somebody who's really good, people just come in and you do this stuff and it's magic, and get over it. It's just not like that. Mm-hmm. Real issues are real issues. They're hard, and you need multiple strategies to be able to navigate those waters. But that means that you have to pick. And picking means you're no longer a technician, you're an artist. Because in an artist, you really get to paint that palette and use a number of colors in the palette to paint the painting, but it should be determined by, what is the presenting symptom? What is that client walking in with? And if it's, I have medial knee pain and I only experience it when I walk downstairs, that's your benchmark. And that's what has to change. and philosophy won't change it, you know? I mean, nothing screws up great philosophies like facts. You know? And the fact is, if it still hurts after all that, no matter what you think you did, guess what? You know, that's not the criteria. So, you know, I love that sort of stuff. I love the challenge. I think again, it drives us to be better, but at the same time, it makes us artists. You know?
True,
how great is
true.
that? I mean, it's just a wonderful thing.
And then, do you teach classes nationwide then too?
Yeah. So we have for many years. We do about now it's over 100 educational events per year.
Wow.
Yeah. So from really the East Coast to the West Coast and kind of everything in between. That's one aspect. And that's phenomenal. I've also been doing a lot of lectures and presentations for, like for instance, I've been doing presentations at the University of Illinois Medical School to the MD PhD program, talking about soft tissue and massage therapy. That's, you know, what a great thing to look at fourth-year med students and presenting to them about who we are, what we do, and how that might be a resource for them in the future, because they are the future doctors who are going to be out seeing people who actually have these problems.
Yeah, because we sometimes have to educate doctors and everything else, because sometimes they'll say, oh, no problem for any kind of diseases and stuff like that, but we sometimes have to just remind them to look at these kind of things.
And talking to those people and talking to the professors at the medical school, they see this enormous gap. It's a chasm, really, of people who hurt, and oftentimes it's the bigger gap probably is people who hurt but don't see their physician because they don't know that, you know, they just don't feel like it's bad enough to, you know, they're still going to work, they're still suffering in a way, they're still hurting, but they can still live their life. They just don't know that something could be done to help them do it with a little greater sense of ease, and that something can be done here. And I think that's the role that we fit in, and I think those physicians really see that. I mean, they see that on a day-to-day basis. And they also understand that they don't have a lot to offer those people. And if we can fill that need, we are filling something that they feel inadequate to do. And in some ways, if you want to be successful, you're successful when you make other people successful. So if we can fill a void that they...
Can I quote you on that? That's cool.
Well, you know, it's so important because, you know, when dentists... I have a clinic in Champaign, and we have 16 therapists. I've had it since '82. We get tons of referrals from dentists. The people that they are referring, people who have just, you know, jaw pain and restriction, that's not something that that's not who they want to see, right? They don't know what to do for that person. If you can fill that void for them, you're on their Christmas card list, you know? But and it's not like we're taking things away. We're adding to the picture for them. What a great thing. And so we're filling in a place, and we're adding one brick to that wall, and that's what we should be doing, contributing.
Definitely.
To the larger picture. You know?
And how can people get more information about your modality and about yourself?
Well, the website is nmtmidwest.com.
Okay.
So people can go there. There are, you know, things on YouTube, but go to the website first and learn more, and see if it's something that resonates, you know, for therapists. I mean, you know, we're all about the problem-solving aspect, and some people really resonate with that, and others not. And so, like everything else, you know, if this is something that matches what you need, then we're here to serve you.
Okay.
So,
well, thank you very much, fellow Norwegian.
That's awesome. Thank you so much.
Thank you.
Thanks for taking the time, and thanks for all you do for the profession.
You're welcome.
Much
thank
appreciated.
You too.
All right.
Thanks, everyone.